Hello and welcome. Today we're diving deep into a specific and often overlooked lung disease, schistosomiasis-related pulmonary hypertension, or SHPH. This is a serious condition that affects the lungs and heart, stemming from a parasitic infection. We'll explore what it is, how it develops, and what can be done about it. The culprit behind SHPH is the schistosoma parasite. These parasites live in certain types of freshwater snails and are released into the water. Humans become infected when their skin comes into contact with contaminated water. Once inside the body, the parasites mature and migrate to blood vessels in the liver and intestines, where they lay eggs. These eggs can then travel through the bloodstream to the lungs, triggering a cascade of problems. Now, let's talk about the how. The schistosoma eggs, when lodged in the small pulmonary arteries, cause a chronic inflammatory response. This inflammation leads to the thickening and narrowing of these blood vessels. This is pulmonary hypertension. Over time, the increased pressure in the pulmonary arteries forces the right side of the heart to work harder to pump blood through the lungs. This can eventually lead to right heart failure, also known as cor pulmonale. The body struggles to get enough oxygen, leading to significant health problems. Schistosomiasis is prevalent in many tropical and subtropical regions, particularly in Africa, South America, the Caribbean, the Middle East, and parts of Asia. Therefore, SHPH is most commonly seen in individuals who live in or have traveled to these endemic areas and have been exposed to freshwater sources. Precise numbers are hard to pin down, as SHPH often goes undiagnosed or is misdiagnosed as other forms of pulmonary hypertension. However, in endemic regions, it represents a significant proportion of pulmonary hypertension cases. The signs and symptoms of SHPH can be subtle at first, often mimicking other respiratory or cardiac conditions. Common symptoms include shortness of breath, especially during exertion, chest pain, dizziness or lightheadedness, and swelling in the ankles, feet, or abdomen. As the condition progresses, these symptoms worsen, and individuals may experience cyanosis, a bluish discoloration of the skin due to low oxygen levels in the blood. Diagnosing SHPH requires a multi-faceted approach. Doctors will typically start with a thorough medical history, including travel history and potential exposure to freshwater sources in endemic areas. Physical examination, blood tests to look for evidence of schistosomiasis infection, and chest X-rays may also be performed. An echocardiogram is a key test to assess the pressure in the pulmonary arteries and the function of the right heart. The definitive diagnosis, however, often requires a right heart catheterization, an invasive procedure that directly measures the pressure in the pulmonary arteries. While schistosomiasis-related pulmonary hypertension isn't categorized into specific types like some other diseases, its severity is graded based on the degree of pulmonary hypertension and its impact on functional capacity. This grading system helps doctors determine the best course of treatment and monitor the disease's progression. The treatment of SHPH focuses on two main goals: treating the underlying schistosoma infection and managing the pulmonary hypertension. Anti-parasitic medications, such as praziquantel, are used to kill the schistosoma parasites. To manage the pulmonary hypertension, medications that dilate the pulmonary arteries and reduce pressure may be prescribed. These can include phosphodiesterase 5 inhibitors, endothelin receptor antagonists, and prostacyclin analogs. In severe cases, oxygen therapy or even lung transplantation may be considered. The best way to prevent SHPH is to avoid exposure to contaminated freshwater in endemic areas. This includes avoiding swimming, wading, or washing in freshwater sources known to harbor the parasite. If contact is unavoidable, vigorous toweling off after exposure may help reduce the risk of infection. Public health initiatives aimed at controlling snail populations and improving sanitation in endemic areas are also crucial for prevention. The prognosis for SHPH varies depending on the severity of the disease, the timeliness of diagnosis, and the effectiveness of treatment. Without treatment, the condition can be fatal. Early diagnosis and treatment with anti-parasitic medications and pulmonary hypertension-specific therapies can improve the quality of life and extend survival. Research is ongoing to develop more effective treatments for both schistosomiasis and pulmonary hypertension, including novel drug targets and innovative delivery methods. Scientists are also exploring the potential of vaccines to prevent schistosomiasis infection in the first place. Continued research offers hope for improved outcomes for individuals affected by this challenging condition.